The first one I'm going to talk about is obviously folic acid. If your doctor tells you about no other antenatal vitamin that you should be on, he or she must tell you about folic acid. Just for you to realize the importance of your doctor actually telling you about folic acid. Some years ago, there was a young lady that had spina bifida, which is a condition that happens as a result of the pregnant mother not having enough folic acid. The child that ended up being born several years down the line sued the doctor that was looking after her mother during pregnancy for not telling her mother that it was important for her to be on folic acid. Why? Because she ended up with neural tube defect that impacted her for the rest of her life. So it is very important. So just in case your doctor has missed that very important information, I am here to tell you. Folic acid is of absolute paramount. There should be no compromise on all pregnant women being on folic acid. The reason why folic acid is absolutely crucial is because it plays a significant role in DNA synthesis, in the repair of DNA. It's also important and needed in the rapid cell growth and cell division that occurs during the early stages of pregnancy, when the organs and the tissues are developing. A little bit more about neural tube defect, which I mentioned earlier. Folic acid is important in preventing neural tube defect and anencephaly. In these two serious conditions, the baby's brain and spinal cords do not develop properly. The neural tube, which eventually goes on to form the spinal cord, develops very early on in a pregnancy, usually in the first 3 to 4 weeks. And as most of you will be aware, you don't even know that you're pregnant at that stage. Therefore, all women in their reproductive years who are wanting to get pregnant should already be on folic acid even before they fall pregnant. Other birth defects that happen as a result of an inadequate level of folic acid in the pregnant mother include cleft lip, cleft palate, as well as certain heart defects. So for women who have no relevant past medical history, who are normally fit and well, are not on any significant or relevant medication, their dosing should be 400 micrograms daily for the first 12 weeks of the pregnancy. So I get all sorts of questions, particularly to do with brands of antenatal vitamins. Look, I'm not going to know the content of each and every single brand. What you must ensure when you go and get your antenatal vitamin from the pharmacy is that the brand that you're taking contains an equivalent of 400 micrograms of folic acid. If it doesn't, and you are hell-bent on getting that specific brand of antenatal vitamin, you also will need to purchase a separate pack of folic acid, 400 micrograms. And in most countries, you do not need a prescription for that.